Imagine walking into a clinic where your doctor is a robot, analyzing your symptoms, scanning your body with precision, and prescribing treatment in seconds. It might sound like science fiction, but advancements in artificial intelligence and robotics are rapidly reshaping healthcare. From robotic surgeries to AI-powered diagnostics, machines are getting smarter, faster, and more accurate. But can they truly replace human doctors? In this article, we explore how health tech is evolving and whether robots are the future, or just powerful assistants to real physicians. Today we will talk about, can robots replace doctors? The future of health tech. So before we start, make sure to hit the like button and subscribe to my channel. 1. Rise of medical robotics. Medical robotics has evolved rapidly, transforming how surgeries, diagnostics, and even patient care are conducted. The Da Vinci surgical system is a prime example, enabling minimally invasive procedures with unmatched precision. These robots assist human surgeons by providing enhanced control, 3D visualization, and reduced hand tremors. Beyond surgery, robots like TUG for supply delivery and Senex for disinfection are already operational in many hospitals. AI-powered robotic arms can also perform repetitive tasks with consistency and speed that surpass human capabilities. With automation streamlining time-consuming processes, healthcare institutions reduce human error, surgical fatigue, and contamination risk. These robots are not just tools, they're intelligent collaborators. However, their deployment depends on rigorous regulatory approval, ethical standards, and integration with hospital workflows. As machine learning improves, these systems become better at adapting to real-time medical challenges, pushing the question, will their precision ever rival the nuanced judgment of experienced human doctors? 2. AI in diagnostics. Artificial intelligence is already outperforming human doctors in specific diagnostic tasks, particularly in radiology, pathology, and ophthalmology. Deep learning algorithms trained on millions of medical images can now detect breast cancer, diabetic retinopathy, or lung diseases with accuracy levels equal to or better than human professionals. Tools like Google's DeepMind have demonstrated impressive results in identifying over 50 eye diseases with clinical accuracy. AI systems can rapidly analyze complex patterns across large datasets, something human doctors struggle to do under time pressure. Moreover, AI doesn't tire, doesn't get distracted, and doesn't miss things due to fatigue. However, AI still lacks contextual judgment. It may flag a finding as significant when it's clinically irrelevant. That's where the human element remains vital. Current trends suggest a future where AI handles first-line diagnostics, flagging results for human review, which could drastically improve efficiency and accuracy while reducing misdiagnosis and healthcare costs. 3. Robot-assisted surgery. Robot-assisted surgery is revolutionizing how procedures are performed, offering smaller incisions, shorter recovery times, and greater precision. Surgical robots don't operate independently but extend a human surgeon's capabilities. Systems like Da Vinci allow precise movements through robotic arms that mimic the surgeon's hands, but with millimeter-level accuracy and enhanced dexterity. Procedures such as prostatectomies, cardiac valve repairs, and hysterectomies are now commonly done with robotic assistance. Even complex brain and spinal surgeries are seeing robotic integration. Robotics also play a key role in microsurgeries and minimally invasive procedures in fields like ENT and ophthalmology. With real-time imaging integration and AI-driven guidance, robots can navigate sensitive structures better than human hands alone. However, the learning curve for surgeons and the high cost of robotic systems remain barriers. While robots can improve outcomes and reduce errors, they are not autonomous. Human oversight is still required, making these tools powerful assistants rather than doctor replacements. 4. Telemedicine and virtual care. Telemedicine, powered by automation and AI, is transforming how patients access healthcare. Platforms now offer virtual consultations, AI-driven symptom checkers, and automated follow-ups. Chatbots like Babylon Health or Ada Health can handle triage, answer common health questions, and recommend actions without needing a human clinician initially. These tools are especially valuable in rural or underserved areas where physicians are scarce. Wearable devices and AI-enabled health monitors also provide real-time data to healthcare providers, enabling remote diagnosis and chronic disease management. With 5G and real-time video capabilities, remote surgeries via robotic systems are becoming feasible in emergency cases or during global pandemics. AI algorithms can even analyze speech patterns or facial expressions in video calls to detect depression, neurological disorders, or pain levels. Despite the potential, telemedicine has limitations. Some conditions still require physical exams or procedures. Nevertheless, it's clear that virtual care and robotic platforms are reshaping healthcare delivery at a fundamental level. 5. Emotional intelligence in healthcare. One of the main barriers preventing robots from replacing doctors is the lack of emotional intelligence. Healthcare is as much about human connection as it is about diagnostics or surgery. Patients seek empathy, trust, and personal reassurance, traits that even the most advanced AI struggles to replicate. While robots like Pepper or PAR are designed to provide emotional support in elder care or pediatric wards, their emotional responses are pre-programmed and lack true understanding. Doctors, nurses, and therapists use intuition and life experience to assess patients' mental and emotional states, which influence treatment decisions. Human caregivers detect subtle changes in tone, body language, or behavior, nuances a robot might miss. Moreover, ethical discussions around end-of-life care, mental health, and chronic pain require sensitivity and moral reasoning. 6. Data, ethics, and decision-making. AI and robots thrive on data, but that brings immense ethical and legal challenges. Medical decisions often involve gray areas where moral judgment, patient values, and cultural context matter. Who is liable if a robot makes a harmful error? Can a patient sue an algorithm? These questions still lack clear answers. Furthermore, biased training data can lead to unequal outcomes, especially for minority groups underrepresented in medical datasets. Algorithms may recommend treatments based on patterns that lack human context or consideration for socioeconomic factors. There's also the issue of consent. Can a patient fully understand and agree to treatment directed by AI? Doctors are trained not only in medicine but in ethics, communication, and social responsibility. Until AI can explain its reasoning in human terms and be held accountable, it cannot truly replace doctors. 7. Cost, accessibility, scalability. While health tech promises to reduce long-term costs, initial investments in robotics and AI are substantial. Robotic surgical systems cost millions, require specialized staff, and ongoing maintenance. This limits their availability to well-funded urban hospitals, widening the gap between rich and poor healthcare systems. In developing countries, even basic automation like electronic medical records is a challenge. However, the scalability of AI-based tools offers hope. Once developed, an AI diagnostic algorithm can be deployed worldwide at minimal cost. Smartphones can host diagnostic tools, while cloud-based robotics can offer remote assistance. AI-powered chatbots may handle basic triage for thousands simultaneously, easing the burden on overworked healthcare systems. Still, language barriers, data privacy laws, and local medical regulations affect rollout. Governments and private sectors must collaborate to ensure equitable distribution of these tools. If you liked this video and would like to see more like it, please give it the thumbs up. Leave a comment and click the button to subscribe.